How about yesterday?
That'll work.
I mean, I think one of the things I try to both embrace and communicate to the people that I train, both researchers, but most especially the psychotherapists that I train is about humility and about being careful about how you view yourself and that sort of thing. And so I will let my students know that I do clinical work all the time, and there are often times when I don't know what's going on. I'm not quite sure what's happening, and a piece of that is actually the joy of doing psychotherapy, because you don't know what's coming. But there still is a little piece that says, okay, am I going to be able to navigate this? And I do pretty quickly wind up relying on my training and just reminding myself, don't, stay sitting in the chair and listen and just do what you do, and something will become clear as we move along. And so in that sense, that's kind of a constant for me. And I think to remind myself about this, that every new person that walks in the door is incredibly unique. So I don't know what I'm going to run into whenever I start a process of psychotherapy, even though I may even be focusing on a particular domain. The uniqueness of each person is always a bit of a challenge. And again, that's part of the joy of doing psychotherapy, but it's also the challenge of doing psychotherapy. So I'm not sure if that fits what you're kind of looking for.
No, it totally works. Can you think of a time early on when you had sort of the opposite experience? When you had oh, maybe I can do this?
In graduate school, I started 2 file folders: humble file and not so humble file. And so whenever anything kind of good, like I got a scholarship or something, I'd stick it in the not so humble file. And the humble file was quite a bit bigger, I have to say, over time. I guess when I was offered a position at UBC, that sort of gave me a sense of, maybe I am doing something here that people can resonate with. Those are moments that I feel like, okay, people are actually reading what I'm writing. And then there's the odd time I'll be walking from my office down the hall, and there'll be most especially in the summer, there'll be a student visiting from somewhere who came to the department hoping to bump into me because they've read some of my work. So that happened yesterday, actually. And it's very powerful when that happens, that somebody actually walks across the campus just to hope that they might be able to chat a few minutes. And I find that incredibly powerful. And I try to be as gracious and as accommodating as I can, in the middle of a day. But those are moments that I think, okay, well, maybe this is resonating with some people. So
can you remember when? Do you have like a visceral memory of when you found out that, like, when you got the offer from UBC, sort of like what was that? Was it a letter you opened, a phone call you got?
I think it was a phone call from a colleague. I didn't know her very well, but Professor Lynn Alden, who was one of the people that sort of encouraged me to apply. And I think she told me, and I was stunned in 2 ways. First off, because our clinical program at UBC has the reputation of being a very behavioral, cognitive behavioral, and not particularly pleased with a psychoanalytic or psychodynamic perspective. And that was my perspective, and I spoke that in my job interviews and that
psychodynamic.
Sort of thing. Yeah. So on the first hand, I was kind of taken aback a bit by that, but also that I'd always seen the psychology program at UBC as indeed as it is a very powerful research facility. And so there was a bit of that, not a bit, there was that sense of imposter, both, I can't believe they offered me the job, and am I up to the task of being a professor at UBC? So that notion of imposter phenomenon that exists is firstly familiar to graduate students. And as many of us professionals, not just in psychology or academia, can admit to, if we're honest, that absolutely there are moments throughout our career that sort of rears its head a little bit.
So can you tell me about how you got into studying perfectionism?
So sort of two routes. One, third year undergraduate, taking a personality course and had to do a paper. And it just so happens I had an appointment, I think it was at a dentist's office or something. And I was sitting in the waiting room in the days when they had magazines that you could touch and read. I looked at this and a journal, I was just reading some article waiting for my appointment. And the journalist was talking about perfectionism. And I had been looking for a topic to write a paper on in this course. I thought, oh, that's interesting. Maybe I should think about that. And so I went to the library and found, people were talking about it, but there was absolutely no research, not one empirical paper on perfectionism. And so as a third year, I thought, oh, well, this is interesting. So I wrote a little bit about it and found a few clinical vignettes here and there in the literature, wrote a little bit about that. And then the next year, my fourth year, I had to do an honors thesis. And I thought, oh, well, why don't I see if I can do a research project on perfectionism? And then a master's thesis, kind of same thing. And then a PhD dissertation, continued on. And then applied for grants to fill it out more. And at the same time, I'm doing clinical work with these issues. And so it kind of started that way. That's sort of one contribution to that. The other is I studied classical music. I did a lot of classical music training early on. And early on in university, that was the path I had dreamed of actually taking. And in that
What did you play?
I started out actually classical guitar, but I also studied voice for opera. A little bit later with voice for opera. But in that world, elements of perfectionism are pretty endemic on a bunch of different levels. And certainly in the clinical work I've done over the years with classical musicians, certainly, but other artsy kind of folks, it can be incredibly problematic for those folks, and the demands can be huge, and so the perfectionism piece kind of made had some familiarity with that in that way. So those two pieces kind of. There was a confluence, I guess, at some point of those two pieces. And I just really became interested in it. But most especially, each time I learned a little bit more about it, either clinically or research-wise, it just led to a whole bunch of other, what I found very interesting questions about how far do the negative implications of this personality style reach, and how deep are they, and how do we treat them? So it's just been an evolution over, well, let's see, it was an undergraduate in 1981. So I've been thinking about and writing about that stuff since then. So,
well, that is funny. You probably don't remember this, but like, I don't know, 7-8 years ago, one of the first or second time I met you, I asked you how long you'd been studying perfectionism. And you said something like, since I was 19 or something, whatever it was, 18, 19, 20, whatever it was. Yeah. And that always stuck with me because I think that's very unique. You know, I mean, the primary construct that is like the hub of your work and your thinking, really persisted from when you're an undergraduate.
Yes. Yeah. And so I encourage undergraduates to, if you have an idea, absolutely pursue it. Don't be dissuaded by other people saying, It's irrelevant because I got
Right.
a fair amount of that over my career as well. Don't study that. Nobody's interested in that. Do depression research instead. And
Right.
I just sort of thought, well, I'm interested in it, so I'll do what I'm interested in.
Yeah, it is interesting. I mean, and you can see the logic behind that. You can see the logic behind why somebody would say that, well, if you want to get funded,
Yes.
studying this very fundable topic of depression is more
Yeah.
strategically,
Yeah.
the thing to do rather than this somewhat, this colloquial, but this that you're turning into a rigorous subject.
Sure.
Yeah.
Yeah. Very kind-hearted advice from these people, and maybe that's just my stubbornness or
No,
whatever. I
but
just said I'm interested in it, so I'm going to see if I can do something about it. So
yeah, I mean, it makes, if you're going to spend as many hours as one spends studying something, you know, uh, make it something you care about.
mm-hmm.
So okay, so let's get into it. So I want to do. Would it be reasonable to start off with asking how you define perfectionism, and then is it reasonable to talk about it broadly before we
Sure.
get into sort of the quote unquote the subtypes? You can change my
Yeah.
language on this.
Mm-hmm.
Is it reasonable, or does it need? Do you think you need to really do the subtypes because it's so different?
Well, let me talk about it broadly first, and then we can get into some of the weeds of it if you like. Um, First of all, and the majority of my thinking and conceptualizing comes from working with patients. Yes, I do a lot of research. Yes, I do a lot of reading in the field, and I learn about it that way. But in truth, the way I really learn about the people who have this pernicious personality style, the way I learn about is from the clinical work that I do. And so the patients teach me about who they are, how they function, what they do, how they work. And that informs me, and it informs the way I think about the construct. It informs the way I develop treatments and how I do my psychotherapy with them. And it also informs what kind of research questions I ask. And so I think that's been the really valuable part. If I've made contributions in that domain, it has come from the clinical work that I have done with the people, and that's informed everything that I do. So when we're talking about the how we define perfectionism or conceptualize
Just
it.
to stop you just
Oh, yeah,
real quick, just because I think I just want to make sure I'm understanding you right, which is that a lot of your insights, your like those seeds of ideas, there's like, oh, well, maybe those are being, a lot of those, the majority of those are come from your clinical experience.
yes. And
Okay.
the theoretical models that we've developed come from understanding people that I've worked with.
Got it.
So I'm not really studying perfectionism. I'm studying people who have perfectionism.
Right.
So it's again, it's a subtle distinction,
Mm-hmm.
but one that's really evident if you read, especially how we do conceptualize the psychotherapy that we conduct. But the way we view perfectionism is a broad, pernicious personality style. That's multidimensional, multi-layered, and multi-level. So lots of times people think of perfectionism, and these are, other academics or clinicians or people in general, kind of as a set of attitudes or thoughts or cognitions. And we say, no, perfectionism is much broader than that, and it's deeper than that. So we think of perfectionism in terms of three broad domains. One domain, and as I said, this comes from learning about it through working with patients, but also doing research kind of at the same time and trying to confirm, kind of what we see. But the three very broad domains involve perfectionism traits. So elements of perfectionism that function like personality traits do. They provide the energy and the drive for particular kinds of behaviors. So when we talk about perfectionism traits, we're talking about really about individuals who have a need to be perfect or a concern with being perfect. And they need to be perfect for themselves or for other people. They can be relatively independent of one another. But in essence, there's this need to be perfect that kind of provides the drivers and the energizers of actual behavior that people exhibit. So we have these traits. We've talked about three main traits that we've identified clinically, but also research-wise. We say, yep, these three traits seem to hold. One is there's a form of trait perfectionism that involves I need me to be perfect. So it's self-oriented perfectionism. It's I require perfection of myself. Okay, and it's not that I feel like I should be perfect or I think I should be perfect. It's a drive and a requirement to be perfect. Okay, so it's deeper than simply thinking about it. It's a powerful, well, it's a relational drive, a deep drive. Another component is I don't need me to be perfect, but I need you to be perfect. So that's other oriented perfectionism, where I may need my children to be perfect. I may need my graduate students to be perfect. I may need everybody on the freeway to be driving to be perfect. Or in general, I need everyone to be perfect. And again, it's not that I need me to be perfect, but I need others to be perfect. And then the third trait component involves the perception that others require me to be perfect. So I may go through life with the belief that my parents need me or needed me to be perfect. My spouse needs me to be perfect. The world needs me to be perfect, etc. So those are three trait components. All serve the purpose of the individual being concerned with needing to be perfect. So it can be both. People will strive and drive to try to be perfect, but they may not be actively striving or driving, but they may be concerned with striving and driving to be perfect. So that's that one component. The other component is, and this is really where the psychodynamic portions come in, is an interpersonal expression of perfection. So you may be able to think of individuals that you would describe as perfectionistic, as I've described it so far, people who need to be perfect. But you also may be able to identify people who they don't really need to be perfect, but boy, do they need to present themselves or appear to others as if they're perfect. And so it's this interpersonal expression of perfection. So if you think of kind of any politician, one of the drivers of their behavior is needing always to try to appear as if they're doing the perfect job. And that kind of goes along with the territory. But some people's personality are kind of characterized by that. So again, they don't need to be perfect, but they need to appear to others as if they're perfect. So that's that second piece. Now, there are three ways to try to appear perfect to others. One is I can it's called perfectionistic self-promotion. I can promote myself as perfect to you. So I can tell you how wonderful I am, how perfect I am. I can demonstrate to you these things that I do perfectly. And, as soon as I say that, you have a sense of, okay, here we're talking about a narcissistic process and very much. And that is one element to try to convince you that I'm perfect. Another way is never to demonstrate to you anything I do that would be less than perfect. So I'm not going to speak in public because I might stumble over a word or stutter or mispronounce something, and I cannot display any behavior in that way that will demonstrate an imperfection that I have. So I will not display any behavior that I believe is less than perfect. Okay? So the assumption is if you don't see any imperfect behavior, you're going to believe me to be perfect. And then the last piece is I will never disclose to you any imperfection. So in a conversation with you or just in an interaction with you, I won't talk to you or tell you or reveal verbally any piece of me that is less than perfect. Okay. And again, once I sort of say that, a lot of people assume right away, okay, well, yeah, I can see that intimacy is going to be a real problem for those folks. Relationships are going to be a real problem for those individuals indeed. And then, sorry, go ahead.
Well, I was just going to ask, so just, I don't know if this is the right time to do it, but so we sort of have these two broad framings. And
yes.
So one is a need for perfection, and the other is a need to appear perfect.
Yes. Yes.
Okay.
And they're distinct from one another.
Got it. Okay. And then within each one of these, there are these
different
different
ways to kind of manifest those components.
And I guess there's a couple levels. So one, the need for perfection, and then that interpersonal expression of perfection, sort of the general, what do those two things tend to show up in the same people? And then, do they sort of, co-vary typically or often? And then, of course, the other question is within those, when you have those three different, that I need to be perfect, I need you to be perfect, or others need me to be, do those sort of do those co-vary?
I'm glad you asked that, because when you present and when you teach people about this stuff, you teach them as these separate, independent constructs. And you have to do that in order to get people to understand the constructs. Remember, I study people. I don't just study in people. They overlap. They combine. It can be quite complex. There can be fairly consistent covariance between different elements, but you get all sorts of combinations of those behaviors, and those behaviors can show up at different times in a person's life as well. So a person may have more of a concern about not displaying an imperfection at one point, given the circumstance of what they're doing in their life. And then at another point, maybe more focused on not disclosing an imperfection.
Is one aspect of this like the lack of flexibility from like situation to situation? So let's just take the I need me to be perfect, sort of just to simplify it.
Yeah.
That, if I'm a musician, right? If I'm a classical musician and there's a certain, you're auditioning or you have whatever, right? There are certain times when like a ridiculously elevated drive for perfection is situationally valuable and even adaptive, but if I was that musician and I didn't keep it really isolated, right. I brought that into all sorts of other places. Okay. And even, you could see how maladaptive it would be where when I'm sitting in the practice room by myself, there's nobody else there, that oftentimes you don't want to be perfect. You want to push yourself, right? So you want to make mistakes. You want to let that be okay in that space. But if I'm telling myself I can't do that here, right, that's going to be maladaptive even in terms of your musical abilities or musical achievement.
Sure. What you're describing has been one kind of conceptualization of perfectionism. What I'm talking about is not trying to perfect things or tasks or performances. At the root of all of this is I'm trying to perfect the self. And where it comes from is I have a deeply flawed sense of myself. I should say that differently. I have a sense of myself as being flawed, defective, not good enough. Okay. And that there's something fundamentally wrong with me. And in order to deal with that, I will choose, if I'm perfect, then I'll be good enough. And use perfectionism as a way of trying to repair or correct the self, to not be flawed and defective. So there's a difference between going into situations and tasks attempting to correct the sense of being flawed and defective and the sense of trying to have a perfect performance. So there's a researcher by the name of Goudreau at the University of Ottawa, started out in the perfectionism field and moved toward talking instead about perfectionism as being healthy and adaptive, which I always thought was a crazy idea anyway. But he calls it excellencism. And there's a real distinction between striving for excellence and really high level of performance and striving for perfection. And they're very different, and that's always the way I've thought about it. But he took the ball and conceptually said, "Well, this isn't striving for a really good performance and high standards is not perfectionism. That we're going to call that excellencism. Used to call it high achievement striving, even hyper conscientiousness." Healthy, adaptive, potentially adaptive things, whereas the perfectionism is maladaptive. So there is a distinction that's there. So if I need to try to correct this flawed sense of who I am, there can be a variety, all of the domains I can be focusing on in order to try to do that. If I happen to have a talent in one domain, it's not that I have to be it's not that I'm trying to be the perfect javelin thrower in the Olympics. It's that I'm trying to correct a sense of being flawed by being a gold medal winner in javelin throwing in the Olympics. And what people discover is even if they win that gold medal, it doesn't fix that flawed sense of self. Mm-hmm. But so the again, from a psychodynamic perspective, we're trying to understand what's driving and pushing and motivating the behavior, what's causing the existence of perfectionism. And in the theoretical work we've done, we talk about, okay, well, there's a need to have a sense of being good enough, a need for self-esteem, a need to feel like I'm an okay person in the world. There's also a need to fit and belong and be acceptable to others. Okay, so, and those are the drivers. And when those two needs, fundamental basic needs, are thwarted, one strategy is maybe not exactly the right word, but one of the things that people learn often as children, well, if I'm perfect, then I won't be flawed anymore. Or if I'm perfect, then I'll be acceptable. I won't be rejected. I won't be abandoned by other people. I won't be ridiculed, humiliated. And so they use trying to be perfect or appear to be perfect. They use that as a way to try to repair the self, or by feeling better about the self, or by being acceptable to others.
So you said that there were two specific needs that you were thinking about, and I just, if you'd I missed it.
Well, I mean, one is called a need for self-esteem, a need to feel like I am good enough, like I am acceptable in my own judgment, that I'm a good, decent person, that I'm a deserving person. So that, I mean, we could call that broadly need for self-esteem, but that term itself is not. It's not just self-esteem. Self-esteem has too many connotations with it, that it doesn't quite capture that sense of I don't have a real sense of identity. I don't have a cohesive self. And if I'm perfect, then I will feel whole. So it's that's one driver. The other driver would be to feel like I fit in the world, I belong, somewhere. I belong with people. I'm acceptable to others. I matter to other people. I'm important. I'm relevant. Other people care for me. I'm lovable. Uh, so that drive, that's another powerful driver. And so very often you hear patients talk about needing to be perfect in order that other people will care for me, or most particularly, won't criticize me, won't reject me, won't think of me as strange or weird. Um, so
Mhm.
those are the two fun. I mean, we've gone from describing what perfectionism is to the actual model of how it develops and what drives the behavior. Um, but it's at that deeper level where the person is using trying to be perfect or appear to be perfect to fix themselves or to fix their position in the world. So,
And I would say one of the things I thought about before
yes.
having this conversation is like trying to really sort of nail down how your thinking about perfectionism is different from colloquial, thinking
Oh,
and uses of the term. And I think, I mean, you're really nailing it right at the outset here, which is that this idea of, you know, I need to be perfect, or, others need, like, that underlying belief. I mean, a belief might, but like a
a,
foundational
it's a
framing of everything.
yeah, it's a philosophy of life. Sometimes we call it a way of being in the world. Is I'm not good enough, and I have to be perfect in order to be good enough, to have a place, to have a sense of self that I'm okay.
Right.
So it's a very fundamental deep needs that if they're thwarted in some sort of how they're not, the needs aren't met. I mean, like any, like we always, when we have a powerful need that's not being met, we try to do something about it. And one of the ways that people learn to try to do something about it, and again, it's often very early in their life, is this notion: if I'm perfect, that's the solution to this, and doggedly pursue it. And intriguingly, like the paradox is, people will hold on to this notion that if I can be perfect, then I'm going to be cohesive, then I'm going to fit and belong in the world. And we all know the maxim: nothing is perfect. It's constant failure. So they experience constant failure. And, from a behavioral perspective, if you punish something, it reduces its frequency. So theoretically, from that perspective, a perfectionistic person should experience failure and therefore not be perfectionistic anymore because they're not being rewarded for being perfect. And it's not the case. It's more this psychodynamic, it's more consistent with a psychodynamic perspective that the perfection is an attempt to try to meet these needs, and they just don't work. So we typically increase the behavior even more. And people spend their lives attempting to perfect themselves and never, ever doing it. And as a consequence, live pretty tortured lives.
Right. When you're talking about this, I think a lot about like the some of the interpersonal theories of personality disorders, and
Yes.
that this is, that it's very much that there are these maladaptive ways of responding to try to get these frustrated needs met, but they just don't work.
Correct.
But you're right. But like it's that is interesting to think about it from, if we took a pure behaviorist's perspective, and I'm sure there are some behaviorists that would have some very sophisticated ways of explaining this, which maybe would be quite reasonable.
Sure.
But that this idea of, but we keep doing them, right? So
Yes.
like, and that's what makes it maladaptive is I want this thing, I have this tool that I'm going to use to get this thing, but it's the wrong tool. But we still continue to use it over and
Yes.
over and over again.
And it's very interesting you say that, because that's a piece of the treatment is, I mean, we can't just say to people who start in therapy, oh, you have to stop using perfectionism because it's the wrong tool. But it's exactly what we're trying to do and teach the person experientially that that trying to be perfect really does not work, because indeed it is the wrong tool. And in fact, the whole premise of needing to be perfect or appear perfect is wrong, about that sense of being flawed and defective. That along the line, somewhere in their life, they have learned, and in some cases been taught, but mostly have learned, that there's something wrong with me. I'm flawed, I'm defective, I'm just not enough, I'm not good enough. And from that position, they go forth and try to correct it by attempting to be perfect. Or some people will use narcissism, other people use dependency. There's a variety of different pathways, but many people just try to be perfect or try to appear perfect in order to correct that. So the work then becomes, indeed, trying to be perfect is the wrong tool to try to feel cohesive and whole. And so that's actually where we do the work of psychotherapy. So I'm bouncing around a little bit here, but when I do therapy with people with perfectionism, very seldom does the concept or the term perfectionism come into the dialogue.
Right.
We're working more at those underlying relational needs that give rise to the perfectionism.
So, because we're definitely going to jump into treatment stuff. Before we get there, a couple more things I want to make sure to hit. So,
okay,
so that makes sense for me for the I need to be perfect, or my perception that others need to be perfect. What about this other-oriented perfectionism? This sort of I need you to be perfect.
Right. Well, that's one of the perfectionism traits. Actually, we haven't gotten to the third component of the.
Oh, well, let's do that. Let's do that. Let's do it. Then we'll come back to it.
We'll come back to the other oriented, or come back to the third component.
What would you prefer? What would make more sense, do you think?
Well, why don't I just answer the other oriented at this point, just because you asked it. So it's one of the traits, I need others to be perfect. And if you know borderline pathology at all, with diffuse boundaries, borrowing identities of other people, if you know borderline pathology as well, they don't have a sense of identity themselves. They'll borrow others in order to have a sense of cohesiveness. Other oriented is a similar phenomenon. So if we're friends out in public, I will need you to be perfect, because whatever you're like will reflect upon me. So that if you're a high status person or you're a superstar, I gain status, I gain worth by your perfection. So it's that borderline diffuse bound, I borrow your identity. And so I need my kids to be perfect, not because I want them to be successful. I need them to be perfect because I'm going to look like a crappy parent if they're not. And so it is that borderline pathological process that is evident in the other oriented perfectionism. So it ultimately comes back to a way to try to feel better about the self. It's very pernicious. That piece in particular is very pernicious. But it's quite different than needing the self to be perfect, or perceiving that others need you to be perfect.
Well, yeah, I mean, of course. I mean, if I believe that I need to be perfect, at least I have some control over that. Where if I need you to be perfect, I have probably little actual, control over that. And the way I'm going to try to exert control, presuming that I am, is going to be not good.
Draconian, hostile, critical, desperate. And you see this in a variety of different ways, but sometimes you see it on the sports field with kids, or you see it in other contexts where we need the spouse to be perfect, or even graduate students, professors who, their graduate students' performance is going to reflect absolutely on them, and so they have to drive those students not to make a fool of the professor. That's kind of the mechanism that's there, but again, very pernicious
Yeah.
in that fashion. So
okay, third major.
Okay, so we have the traits, that self, other, social, the drivers and need to be perfect. We've got the interpersonal expression, meaning I'm going to present myself to you, Dan, as a perfect guest. I'll tell you how wonderful I am, how wonderful my clinical skills, all of that sort of stuff. I'm not going to tell you about what a horrible golfer I am. I'm not going to show you something, those sorts of pieces. But this third piece is the intrapersonal expression of perfection, that relationship I have with myself about the expression of perfection, I should say. And the best way to kind of capture that intrapersonal element is we all kind of have a dialogue with ourselves. Not constant, but it's there. So when you get up in the morning and you're brushing your teeth, you have this conversation with yourself. Like, okay, I've got to remember, I've got that appointment I have to get to, I've got to pick up milk on the way. And it's just a benign kind of dialogue you have with yourself. Well, we also know that sometimes that dialogue can be not so benign. And for some individuals, that dialogue can be going into an interview. I've got to do this perfectly. I've got to make sure I don't make any flaws. I can't look like a fool. And again, this inner dialogue, and at times it can also be highly critical. How could I do that? How could I make? I'm so stupid. No, nobody cares about me. And this harshly critical internal dialogue. And when you think about what that is, one of the things I'll say to patients is, if you took that dialogue you have about yourself and you said that to your spouse, or you said that to your child with the same words, just change the pronoun, what would happen? And people say, well, I'd be arrested, I'd be thrown in prison, I'd be divorced, it would be incredibly abusive. And so we're talking about here, okay, but this is the nature of the relationship you have with yourself, is that harshly perfectionistic, harshly critical piece. And so we talk about that as that intrapersonal expression of it, but we also talk about it as a perfectionistic self-relationship. Nasty, harsh, unforgiving, and at times horribly abusive in extreme versions. And so we've got those three pieces. The last one is a little bit newer conceptually, but we're talking about that harsh dialogue, but also a lack of self-soothing dialogue, a lack of self-affirming, a lack of caring for the self, meaning that there's a lot of neglect of self. And this is the piece we believe is where the self-harm comes in. So perfection is very highly associated with, there's very good research on suicide ideation, high intent suicide attempts, clinicians' rating of suicide risk. And we believe it's that piece, that perfectionistic self-relationship, that may be at the crux of the suicidal behavior with perfectionistic individuals.
Could you unpack that a little bit?
Sure.
Just conceptually, how you think about. Go ahead.
Okay. If you think about a continuum of the treatment of the self. So at one end, you've got, affirming, confident, self-caring kind of individual who both has a dialogue about, okay, I'm going into this very scary sort of situation. I'm going to be okay. I've done this before, and the soothe and comfort the self. That's at one end. And then you can see movements toward the middle where maybe people aren't soothing of the self, and they just have an absence of that, and maybe some element of, okay, well, I'm going to screw it up again, and they become more and more negative about expectations to, I'm not worthy to even care for myself. That piece of self-neglect, I'm not worthy of caring. And you have a clinical practice, you've seen patients who exhibit that, they just, like, they're not worthy enough to actually take care of themselves, to further along the continuum to, I'm so awful and horrible, I don't even deserve to live. So it's that relationship with self. Now, this is conceptually at this point, we're talking about how it's related to suicide, but the literature is out there. There are elements of socially prescribed, especially, is a extremely good predictor of suicide behavior in children, adolescents, adults.
Socially prescribed.
Yeah, where I believe that everybody or others require me to be perfect, and I'm not able to be perfect. And that's a piece. But we think it's actually the self-relationship that's most relevant in terms of the suicide. So we've started some research to kind of address that.
I was also thinking, with that self-relationship thing, as you were describing it, that most suicide theories have some aspect of pain, like that. Yes. People are in psychological pain, whether you call it psych ache, obviously, is one of the, but like that, and so, like, if I'm mean to myself, but also I don't soothe myself, which, I mean, it's kind of it's sort of this internal coping mechanism, and this way of taking something and, taking something challenging and calming it down a little bit. But if I don't have that within me, then I don't have that internal, I want to say capacity, the terminal, the knob that I can turn internally to reduce that pain. So I'm stuck in it for longer, which makes it more, feels more unbearable, yes, right? Absolutely. And so then I just want to, it makes the desire to die just more likely to happen, because I don't see an end to this, or I don't feel I have control of how to turn it down. Or maybe, and from with somebody with this interpersonal expression of perfection, I'm not worthy of turning it down. I should feel this pain.
I'm not worthy. I'm not deserving to live.
Right.
It's about that worth. Remember that defective, flawed, just not good enough for me, not good enough for other people, not good enough to be acceptable to other people. And right. when you mentioned psychache, the Schneidman concept of psychache, when you work clinically with the perfectionistic people, I prepare my students for work with them. The magnitude of pain that these people very frequently exhibit, it's kind of breathtaking at times in therapy. And once you sort of dig down into some of that stuff about the flawed self, the defective self, how that has manifested throughout their life, and where it comes, you start to touch the pain that's there, and it is significant. So some of the when I do a lot of workshops, training workshops on what perfectionism is and how to treat it. And I've got video clips of patients. And I kind of start out the workshop showing these clips of a couple of kids with perfectionism and then a couple of adults. And they're expressing some of the pain that's there. And it is palpable in the room when you put these, when you show the videos of just the depth of pain that's there. So,
what are some of the things that they say?
Well, it is about being despicable, being unloved, that on the receiving end of messages about their uselessness in the world, and it's less about what they say and how they kind of express it within the sessions. You get a sense of the deep pain that's there. So um, bone racking weeping at times. You'll see that with some of these. Well, when you really touch down into some of the depth of some of the, especially some of the beginnings and some of the early phases of the development of the perfections, it's very, very powerful.
Yeah.
So,
Yeah. How do you prepare your like?
uh, how do I prepare the supervisee? I talk about it first off. I show them some vignettes and that sort of thing, and I said just allow yourself to also feel the magnitude of that, but also, you know, to feel the hopelessness, because that's deeply at a piece of that deep pain for those individuals is the sense of hopelessness and helplessness. And again, as a therapist, you know that when there's that level of emotion in the room, it can spill over into the therapist, if you like, where you're not quite sure what to, and to sort of prepare them that way that no, that's just an effect of the affect that's in the room. We just do what we do and continue, and it will kind of, the patient will kind of move from that to get to a better spot reasonably quickly. But the process of therapy will be touching on that periodically throughout the course of the treatment. So.
Right. So, I think I think I'm about a place to jump into the treatment side of things.
Sure.
Is there anything else you want to hit that you think would be helpful, or? And obviously we can bounce back and forth, but
sure. Well, I mean, essentially what I just wanted to describe is that perfectionism is not simply a set of attitudes thinking about being perfect. It's this pernicious, multi-layered, multi-level personality style that can manifest in a bunch of different ways in individuals.
And it's funny when as you've been talking, I a couple times, because I'd sort of like, I want to make clear to the listener how this differs from sort of the colloquial use of, but I'm sort of, as you're talking and describing this, I'm thinking if they don't understand the difference in what you're describing versus, what looks like how we often talk about perfectionism, then they're not paying attention, and I'm sure that they are, because I think it's palpable. Sort of this fundamental perception of oneself and oneself in relation to the world and others, that this is not just, boy, they need the kitchen to be clean all the time. Like this is much more
obsessionalism. Right. It's not that. It's a much deeper. It's a much deeper. It's a much deeper creative way of trying to deal with feeling totally defective and feeling unacceptable to the world. And it's a strategy with the promise of, okay, if I can only be perfect, then there's the promise of good things happening, or the promise of horrifically bad things not happening. And when you work with patients and you kind of tie back to where it originated, very often as children, and that's often where you get the real depth of the pain. You get an appreciation, you help the patient get an appreciation of what an elegant, tragic, but elegant solution to a problem, a childlike solution to trying to feel good enough in the world. A solution would be if I'm perfect. And you think, well, you did the job of a child. You tried to solve the problem of of who you believed you were, or what you believed you were, and you worked at it. You continued. You tried to solve the problem. It just didn't work. And so to take away any sort of sense of that they did something wrong in all of this by becoming perfectionistic, or the consequences of the perfection, the depression, the suicide. No, that this was an elegant solution to the problem, but it's a solution based on a childlike perspective of the way the world works. And then helping the person to kind of get to look at it with adult eyes, if you like, and sort of say, okay, well, let's talk where we can go from here. What are some other ways we can do
Let's
to try to resolve this.
let's dive into it. Do you want to give us a sort of a 30,000? I mean, I think you've been the listener sort of has a good sense of like where we're going in terms of like the treatment work, the treatment that you've been working on for the last several decades. But
yeah. Well, it comes from a psychodynamic perspective, and the first and foremost, again, which is so fundamental to psychoanalytic and psychodynamic therapy, is the establishment of a safe, caring, therapeutic alliance where you work with the person not only to feel, like there's a good connection with the therapist, but there's both safety in that therapeutic alliance, and there's trust in the therapist that they're going to be helpful. And you need both pieces. And so a good deal of the work, especially early on, but throughout the course of therapy, is the establishment and the maintenance of that kind of environment for the person to be able to take some of the risks that they need to take. So in the treatment, I'll try to give a very quick synopsis of it.
Let me, because I think that, and then we can sort of just get in there. But I think something you said that I think is important. I think to an extent in our training and even our talk, like the saying that the therapeutic alliance is, necessary or important or whatever has almost become cliche.
Yes, it has.
Okay. And I don't know if that, but it seems like in your framing that there's something, and there was subtext that you alluded to this, but I think it's worth commenting on because it's become cliche, but it's not cliche. It's extremely important because in this context, I'm imagining a client who believes they need to be perfect, or they believe everybody else needs to see me as perfect. And as the therapist, you're one of everybody else.
People. Yes.
So that relationship, particularly that trust bond, if you want, that's necessary, because if you don't have that, then I, as the person who believes that you need to see me, like I won't be vulnerable. I won't let you. No. You're everybody else.
Correct. Yeah, that's the concept of transference, right? And so in this treatment, we pay a great deal of attention to transference and countertransference, and we use both in the treatment.